Dr. Wolski, in other videos, you talked a lot about the danger of getting, when a person has a surgery of, the particular infections. And one infection you mentioned over and over again is a staph infection. Can you a little bit explain what a staph infection really is and why it is so dangerous and why does one get it in the hospital and not outside? Or maybe one does get it outside. I just don't know.
Well, what we're talking about is methicillin-resistant Staph aureus. That's an infection that originally was in hospitals, and this is the way this bug developed was it was resistant to all the antibiotics that they use in the hospital, so it started spreading inside the hospitals. Now it's spreading out into communities. For example, I had 4 patients in a row who went to the emergency room at our local hospital, and one was, and they were for trivial injuries, or one was for a spider bite, and they lanced that, and they got staph in the hospital and ended up having to be on intravenous antibiotics in hospital for 2 weeks, and they had to put a port into the patient. That's just an access into their veins so they could give long-term antibiotics. And I had 4 patients in a row that got staph infections at the hospital. And then what happened to me, I ruptured my Achilles tendon, and a friend of mine who's an orthopedic surgeon wanted to do surgery, and I just didn't want to go into the hospital and get a staph infection because it's horrible. You get pus oozing and you have to take antibiotics. And so I just splinted. An Achilles tendon is the biggest tendon in your body, and it's the one that attaches to your heel. Anyways, I just splinted that, and it healed fine without any surgery. And I didn't get a staph infection. Well, the next patient I got with came in with an Achilles tendon rupture. I said, well, this is what I did. I splinted this, and this is how they treat it in Europe and Canada and England. But here the standard of care is surgery. And he said, well, he wanted to have the surgery. And I told him what I did because I was worried about a staph infection. Well, I didn't see him for about 1.5 years, and I said, where have you been? He said, well, I got that staph infection you're talking about, and I had to have 4 surgeries, and they had to do tendon grafts, and they said, well, the last one, he was just lucky it took. They told him that the last one was probably not going to take, and he was going to have problems for the rest of his life, but he was out of work for 1.5 years. I didn't miss a single day of work. I was on crutches the next day, and I was splinted for in the special boot that I got. Actually, I got it had to get it from Germany, and so I'm very worried about staph infections, and it's a huge risk for surgeries. It's a huge real risk for surgeries, and complicates surgeries.
Well, I guess that, emphasizes the point you made about, let's not cut the body if we don't absolutely have to, and let's try to explore all other options before. And, bodies are relatively, they're quite resilient if you give them half a chance,
Exactly, and staph, these staph infections, they're infections that are basically resistance to all medications that you can take by mouth. So you have to be in hospital and get an intravenous for a long time, and they can kill you. They can be deadly infections.
Right. So basically, a staph infection it came maybe about a little bit the way. Let's just say we try to kill, ants or termites with whatever, or in the garden, some insects, and they're so used to the new chemicals, so the chemical doesn't kill them anymore. So this type of infection is basically, the name for it is whatever we currently use, all the antibiotics don't work on it anymore. It's immune to it.
Exactly.
Very scary. Thank you very much, Dr. Wolski, for explaining what a staph infection is, and your story about fixing your foot, your kills, is really is quite inspiring. I'm sure lots of people will kind of think twice about first going to the surgeon, but actually trying to cure it in a normal way. Thank you.